All right, so today I want to talk about the Oklahoma City bombing and the disaster response following. So on April 19th, 1995, Timothy McVeigh detonated a truck full of bombs in front of the Alfred P. Murrah building in Oklahoma City. McVeigh and his partner Terry Nichols targeted the federal building due to their frustration with the federal government's handling of the standoff at Ruby Ridge in the Waco siege in 1993. They chose the site to inflict as much damage to the federal government and its employees in retaliation. The bombing killed 168 people, including 15 children, and injured 680 others. They collapsed large portions of the 9-story building and damaged several other buildings on the block. So bear with me here because the response to this disaster was very quick and pretty robust. So at 9:02, a truck bomb is detonated outside the Alfred P. Murrah Federal Building, and immediate search and rescue efforts ensue. At 9:04, the explosion was reported to the Oklahoma Department of Emergency Management, and at 9:07, Oklahoma County Red Cross Chapter and Salvation Army responds to the incident and begins delivering services to the victims. At 9:25, the State Emergency Operations Center is fully operational. The SEOC includes representation from the Oklahoma Department of Civil Emergency Management, the Oklahoma Department of Public Safety, the Oklahoma Military Department, the Oklahoma Department of Human Services, the Oklahoma Department of Public Health, the Oklahoma Department of Education, the National Weather Service, and the Civil Air Patrol. At 9:30, FEMA is notified of the incident and activates the Regional Operations Center. At 9:45, all non-essential state employees are released as Governor Frank Keating orders a state of emergency. At 10:15, Incident Command Post is relocated after a bomb scare occurs at the site. So all of these responses are happening very, very quickly. At 10:20, Timothy McVeigh is arrested at a traffic stop near Perry, Oklahoma for driving without a license plate and is taken to the Noble County Jail. And at 11 a.m., FEMA officials deploy from the regional office in Denton, Texas to the SEOC. So at noon that day, the FBI set up a command post for the incident investigation. At 1:30 p.m., a temporary morgue is set up at the First Methodist Church. At 3:30 p.m., the Family Assistance Center is established at the First Christian Church. And at 4 o'clock p.m., Bill Clinton signs Emergency Declaration 3115E. This is important because it gives the federal government permission to provide emergency assistance to save lives, protect property, public health and safety, and to lessen or avert the threat of further damage. At 6:30 p.m., the American Red Cross opens a shelter for displaced victims of the explosion, and local hospitals report 472 injured and admitted or treated and then released. At 10 p.m., the last explosion survivor is rescued from the rubble, and at 11 p.m., the Phoenix and Sacramento urban search and rescue teams arrive. So 12 a.m. the next morning, the American Red Cross determines that 702 disaster victims have been seen at local hospitals. At 1 a.m., the Oklahoma City Fire Department completes the search of the Murrah building. And at 7:30 a.m., FBI agent Walton Kennedy conducts the first interagency staff meeting with priorities for the disaster response. The priorities include to 1, locate survivors, 2, remove victims, and 3, process the crime scene. At 9 a.m., the first media briefing occurs at the Oklahoma City Civic Center. Some of the events that occurred that afternoon include medical staff and portable equipment being deployed to the medical examiner's office, additional search and rescue units arriving from Virginia and New York, and the disaster field office opening and emergency support functions identified. The emergency support functions identified for this disaster include the ESF2, Communications, ESF3, Public Works and Engineering, ESF4, Firefighting, ESF5, Information and Planning, ESF6, Mass Care, ESF7, Resource Support, ESF8, Health and Medical Services, and ESF9, Urban Search and Rescue. So over the course of the following weeks, the following occur. So the Oklahoma Military Department transfers McVeigh to from Perry, Oklahoma to Oklahoma City, Oklahoma. Heavy rains and winds slow the search of the rescue operations, unfortunately. Which is why the National Weather Service is involved. The Disaster Field Office begins long-term recovery efforts, and FEMA donation coordination, the team begins coordinating those donation efforts. The Survivor Injury Registry is established, which helps officials with victim identification, injury documentation, and ongoing medical needs of the community. FEMA establishes immediate crisis counseling services through the Oklahoma Department of Mental Health. Workers continue to shore up the Murrah Federal Building to ensure safety for search and rescue teams. Local businesses and individuals apply for disaster assistance through FEMA. Victims continue to be found in the pit of the building. Outside agencies begin to demobilize after the primary rescue and relief efforts are complete. Project Heartland is established through federal funding efforts as a mechanism to meet the needs of the bombing victims long term. And then finally, the Murrah building is imploded when search and rescue efforts are complete on Tuesday, May 23rd. So let's talk about some of the key players in this effort on a local level. So number one is the emergency medical service. So EMS was responsible for the first response efforts in the ambulance and paramedic transport services. It is estimated that EMS transported hundreds of victims to local hospitals within the first 2 hours of the disaster. The Oklahoma City Fire Department acted as the incident commander of the incident. The initial response alarms brought 200 Oklahoma City Fire Department personnel to the scene. The fire department was the first agency to implement the incident command system, which they continued to utilize throughout the recovery effort. The Oklahoma City Fire Department depleted their personnel resources quickly and needed to utilize backup personnel from other agencies. Though they needed the extra personnel for recovery efforts, the quick response of other fire departments around the state caused chaos as first responders who were not registered in the incident command system began entering the disaster zone. Eventually, the Oklahoma City Fire Department got control of the swarm of volunteers and they were able to mobilize resources. The fire department was able to remove all live victims of the bombing within an hour and a half of the detonation. So not only was this incident disastrous from an emergency management perspective, it was also a crime scene. Local law enforcement personnel were utilized for recovery efforts, crime scene investigation, and evidence recovery. It is also critical for local law enforcement to keep the streets surrounding the Murrah building clear, as the building was unstable and the search and rescue crews needed unimpaired access. And finally, public works agencies were critical in implementing some of the logistics of the search and rescue efforts. This including fencing the perimeter of the scene, providing sanitary facilities for the rescue workers, providing lighting for the rescue efforts, trash containers, etc. So on a state level, Governor Frank Keating started mobilizing the relief efforts and the rescue teams. Governor Keating declared a state of emergency, which allowed for the deployment of FEMA search and rescue task forces for assistance in recovery operations. Governor Keating was well regarded during and after the disaster for his efforts in helping the victims of the bombings and their families. He and his wife established a $6 million fund to assist bombing victims and provide college scholarships for the children who lost parents in the attack. The American Red Cross was responsible for caring for families of the recovered victims and those unaccounted for. The Red Cross provided food, water, and sleeping arrangements for those who needed it, and volunteers and counselors were on site 24 hours a day for support services. The state medical examiner's office was responsible for tracking missing persons, identifying recovered victims, and notifying family members. And finally, the State Office of Emergency Services was a huge influencer in this response. So Director Tom Fairborn directed this SEOC, which included various agencies helping with the relief efforts. This team was responsible for coordination of the local and state emergency response, as well as FEMA direction. Which brings us to the federal response. So FEMA was responsible for two aspects of the response: urban search and rescue task forces and disaster response for state and local emergency response officials. FEMA deployed several urban search and rescue teams from various states all over the country to help with the rescue efforts. The State Office of Emergency Services was responsible for coordinating the FEMA disaster response efforts. The National Guard was instrumental in the aftermath of the bombing as they helped secure the perimeter of the Murrah building. Not only was the building unstable, it was also considered a crime scene, thus it was important to keep all non-essential personnel off-site. They also helped provide shelter resources for emergency personnel and equipment at the scene. Additionally, a family assistance center was established through the First Christian Church, and the National Guard provided security for the center. The National Guard also captured aerial footage of the site to help coordinate rescue efforts. And finally, the FBI. The FBI worked with emergency personnel to create an identification system for the rescue efforts. Because the site was a crime scene, it was critical to understand who was entering the site and to keep rescue personnel to a minimum. The FBI also attended incident briefings, but primarily was focused on the investigation of the crime rather than the rescue efforts. The Oklahoma City bombing is often regarded as an incident command system success. The hierarchy of the response led to quick work and successful outcomes, relatively speaking. The Oklahoma City Fire Department was the first to implement the ICS for the disaster, and Fire Chief Robert McMahon acted as incident commander. The ICS worked well because all aspects of the response efforts, including various levels of government, nonprofit agencies, and private organizations, respected the chain of command for the disaster. Interestingly, the ICS training wasn't made mandatory for federal crisis responders until after 9/11, which occurred after the Oklahoma City bombing. However, the ICS system was still considered successful. Despite the robust use of the ICS, information regarding the chain of command for this incident doesn't seem to be published. So as mentioned in the timeline of the incident, the response was very quick and very robust. The deployment of various emergency response teams at the local, state, federal, and non-governmental level was critical in the response to the attack, which makes it a good strength of this response. Additionally, the incident command system provided a mechanism for all agencies to work together under one chain of command in order to improve the efficiency of the response. Large quantities of volunteers and donations were available to the disaster relief. Over 2,000 volunteers helped in the relief efforts, and tons of food and supplies were donated to the efforts. Though the volunteers and the volunteers and the supplies were needed, the extent to which the aid came was vast and proved to be also a weakness in this response, which we'll discuss next. The support for each other was crucial in this disaster response. Many of the relief workers became overwhelmed due to the stress of the situation. Throughout the course of the entire operation, relief staff exhibited constant care for one another as they processed the situation. This ensured disaster staff members were safe as they continued their recovery efforts. And finally, the variety of support systems provided to the community were a huge strength in the assessment of this response. The recovery efforts included a variety of support services, including mass care, disaster welfare inquiry, damage assessment, mental health and healthcare services, and logistics and communication. So some of the weaknesses of the response primarily stem from the communication. Cell service was overloaded due to high use after the bombing, which limited the mobility of the response teams. Essentially, people just couldn't get through because the phone lines were jammed. Additionally, many of the communication channels had no common frequencies, so communication via radio during the response was severely lacking. We talked a little bit about this in the previous slide, but the volunteers were huge. So though the volunteers were needed, the quick assignments of volunteers meant a lack of registration or identification of the volunteers going into the sites, which could have been dangerous to the rescue cause. This was mitigated by the FBI identification system later in the response. It was difficult to estimate the need of the volunteers at various sites, so many volunteers were sent home because their services were not needed. Additionally, because so many groups were providing food to the recovery cause, food storage became an issue. Medical support was also a weakness in this recovery. So several dispensaries were established in the area, but they lacked coordination and communication efforts with each other. Additionally, while medical support at local hospitals was strong, the medical support at the site was lacking. And finally, the supplies. Many public health workers were unsure where to get new supplies, thus unnecessary medical supplies were ordered extraneously. So let's talk about the community resilience after this. So Project Heartland was established in response to the bombings, and Project Heartland is a mental health service that provides counseling and intervention services, support groups, outreach, and educational services. A study by Tucker et al. Found that 86% of the 99 survivors they interviewed after the attack utilized mental health services. So the mental health need in this community was really, really huge after this attack. So through other, as far as the destruction mitigation is concerned, through other state funding and grants, as well as Congress appropriating $39 million to rebuild and revitalize the area surrounding the attack, Oklahoma City was able to raise enough money to rebuild the area surrounding the Rothfeld building. And then finally, the Oklahoma City Memorial and Museum. So this Mayor Ron Norick and a task force designed and built a memorial and a museum to honor and remember the victims of the bombing. The museum is also utilized as an education platform to educate students and community members about the attack. So let's talk about some of the changes made after this, after the response. So the biggest fallout was the communication. So the fallout on the communication system wreaked havoc on the response, despite the fact that they had a good incident command system in place. So cell phone receivers were immediately jammed following the attack. So in response, Cellular One increased the cellular capacity of the towers after the attack and donated 1,500 cell phones to emergency relief workers. Additionally, the lack of communication about radio frequency was a huge issue. Since many of the different agencies and relief teams use their own channels and frequencies, structured communication was hard to come by. Emergency response team now use structured radio frequencies for communication. Additionally, the hospital emergency administrative radio frequency, which is used to monitor hospital capacity and clinician availability, was non-functioning during the disaster. Now the HERE system is tested daily. And then, though this isn't a direct change from the Oklahoma City bombing, I think it's an important one to note. So after 9/11, the incident command system training was made mandatory for all emergency response personnel. Better use of the incident command system during this disaster would have provided a more structured recovery efforts. Particularly the lack of the coordination between agencies until a formal incident commander was established, and the lack of volunteer and donation efforts could have been drastically mitigated with a stronger ICS structure in place. Nevertheless, the structure was relatively strong for what it was. And thank you so much for listening.